Okay, hello everybody. This is Alan Hollander. Welcome to Inside the Practice, where we try to bring you timely and important issues from guests who are opinion leaders in the industry and in your dental communities around the country. Our objective, of course, is to provide you with insights that are going to improve the efficiency, productivity, of your practices, and of course, quality of life. I have my excellent co-host here, Sarah Boylan, longtime office manager, practice consultant, and somebody who's worked with us for years. Sarah, welcome. Nice to have you here.
It's great to see you, Alan.
Thank you. Thank you. And we are delighted to have Dr. Barry Taylor with us. Dr. Taylor is has been a practicing dentist for many years in Portland, Oregon. He is currently the executive director of the Oregon Dental Association. He is a volunteer associate professor at Oregon Health Sciences University, School of Dentistry. Prior to OHSU, he worked as a research assistant for 2 years at the U.S. Veterans Hospital in Portland. And he was the ODA's editor of their publication for 9 years. He was also a member, I'm particularly interested in this, Barry. He was also a member of the ADA's Council on Communications, which I'm going to ask about in a moment. I want to finish your excellent bio here. He was awarded Dentist of the Year from the Oregon Association of General Dentists, as well as Alumni of the Year from OHSU School of Dentistry. So what a privilege, Barry, to have you here.
Thank you. I'm really excited for our conversation this afternoon. So thank you for the invitation.
Absolutely. Absolutely. So I was reading your bio and having, our firm, ePractice Manager, we do practice consulting. You know that we've been doing it for decades. And as a result, and as part of doing that, we have surveyed, gotten written questionnaires, which we always do when we go into practices, which is now in the thousands. We get questionnaires from staff, from doctors, and everybody. And if there is a common denominator, if there's one topic that comes up more often than anything else, whether it's from a front office person or a doctor or an office manager, it's the subject of communications. I don't know exactly what the ADA's Council on Communications is about. I imagine it's not about internal office communications, but it's a hot issue. So help me out on that. What does the Office of Communications do?
I think the Council on Communications, so it's made up of dentists from the 17 districts of the American Dental Association. And I think at the most simple level way to think about it is that their job is to come up with the ways and discuss the ways that they can communicate to the membership all of the things that the American Dental Association is doing. So that, that could be the benefits of membership. It could be the advocacy that the American Dental Association is doing. It can be membership recruitment. A lot of it, as you can imagine, is around social media and how to present the views of the American Dental Association on social media, because we have such instant feedback now with people's opinions and whatnot.
Yes.
So it's really about just portraying the American Dental Association, what our values are and what we're working on, and the value of membership.
Yeah. Excellent. Okay, good. Thank you for answering that. Makes complete sense. Makes complete sense. Communication resolves so many things and is so important from the 10,000 foot view of an association like the ADA, as well as all the way down to the granular level of what goes on in an office. So I understand that. Sarah has worked with Dr. Taylor for off and on. They've known each other for a number of years. Sarah, of course, with her background as a very experienced office manager. Sarah, I'm going to let you get this started with Dr. Taylor and ask him some questions that we've been on topics that we've been looking at that we're very interested in hearing about.
Yeah, absolutely. Thank you, Alan. I appreciate it. So, Dr. Taylor, like I said, it's always great to see you. I was so pleased when you said yes, you would join us, because you do have such great experience to share with our audience. And I wanted to piggyback a little bit about what Alan was just talking about as far as communication goes on the ADA level. Now you are the executive director for the Oregon Dental Association, which you wear many hats for. Including, we have the Oregon Dental Conference coming up. You were also, working down with, policy and advocacy. Can you just start with talking a little bit about your role with the Oregon Dental Association and, and, kind of how you got into that role a little bit, please?
Yeah, it's been a great role. And, quite honestly, I feel like it's a role that I was well suited for and was made for me. My mother, which many dentists in Oregon know, she was the executive director for the Oregon Academy of General Dentistry. So I grew up in a family of associations. So I always felt like a huge responsibility to be a member of your professional association and be active in it. So ever since I graduated from dental school in a different century, I was always very involved in organized dentistry, at every level in a number of different groups as a volunteer. And so then in 2020, when I made the switch from being a volunteer leader to actually being on staff and running the association, it was a great transition to make. And I think that I really see it from the dental viewpoint while also seeing the challenges of an association and what our role is. Because I still very, very much believe, of course, in an association and in membership. And as such, it could be with advocacy, it could be with wellness, the benefits. I think there's a lot to be said for the whole association structure.
Yeah. Can you tell me a little bit about what your benefits are when a new grad comes out of dental school? We're always been encouraging them to join the association. Can you tell me a little bit about those benefits?
We have a number between the Oregon Dental Association and the American Dental Association, a number of entities that offer discounts and whatnot. But really, I think that for me, the two biggest benefits are the advocacy that we do, because in Oregon, and I think this is safe to say for every state, it's your state association that is going to be the one that's down in your capital who is advocating for dentists. And that doesn't just mean legislation. It also means, in Oregon, it's the Oregon Health Authority. We're the only group down there advocating for dentists. And I think the second thing that's really, really important, and it's more of maybe a soft, if we have our hard skills and soft skills, we'll call this the soft skill, is the sense of community. We read so much now about the increased stress, increased burnout for healthcare providers. That includes dentists, feelings of loneliness increasing among healthcare providers. And I think an association really provides a structure that has a lot of the answers for a lot of those problems. And that's how come we also do a lot of work around wellness for our members.
Nice.
That's a good, that really resonates with me, Dr. Taylor, because, we've been communicating with dentists for so long. Even, you take a dentist who's extremely successful financially, but sometimes terribly stressed out, and
it's a tough profession. I don't think the two of you fully understand. I understand as a dentist. I don't think people always comprehend and realize what a stressful profession it can be.
Yes. Well, I'm interested from your experience as a dentist and now as somebody who is kind of the leader of this community, from that hat that you wear. I'd like to just sort of drill down on that a little bit. I mean, what are the things that you see that cause this level of stress? There are things that we see internally, but I'm interested in your view on this.
I think, a lot of it, providing the actual dental care, and sometimes maybe the easiest part of being a
Yes.
dentist.
Yes.
We went through our
Yes.
4 years of dental school. If you're a specialist, you've gone on an additional, 2 to 3 oral surgeons, 6, 8 years.
Yes.
So the clinical aspects of dentistry are, I don't know, you could maybe say it's like the easiest part of the job. I think when you start getting into the administration, human resources, and then, be honest, the whole third party payers, and
Sure.
how dentists are reimbursed and the challenges with that. And you add that all together, increasing employment costs, flattening, if not declining, reimbursement from third party payers. It creates a very challenging profession. And I think that there is a stereotype of perception that, dentists have this pretty easy lifestyle, high income and everything. And I don't think people truly understand the hard work that has gone into putting them into that position, and then the day-to-day stresses of trying to be present for your patient, treat every patient, present that care, one patient at a time, be fully attentive to them, while in the back of your mind you're dealing with all these other outside issues that you have to deal with.
Yes, absolutely. Yeah, Sarah knows this all too well. And particularly since COVID, the personnel issues, new staff coming aboard. I mean, let's face it. What doctor has done HR training and is trained in personnel management? Some just minuscule percent of doctors that we meet who really are equipped to deal with that. It isn't why they went to school. And what you say about clinical being the easiest, just boy, do we know that. So I think it's dealing with people, constant turnover. Your assistant who was there one day and then all of a sudden they're gone, and then you have to go through the hiring processes. So, yeah, well, I mean that's what's kept us in business for many years. So, but I really understand what you're saying. I'm curious, just from your view, also from the big picture view, in terms of policy and advocacy. We see all of these things completely. We see all the time the declining reimbursements, the staff issues. What do you see coming up as common denominators, Barry, amongst your constituents, if you will?
I think a lot of times when we talk about third-party payers, it's not just so much the flat and declining reimbursements. A lot of it, I think a huge amount, and this goes back to talking about the stress, is the administrative burden. And that's how come some of the legislation in Oregon we have now, it's addressing such things such as, for example, prompt payment, filing a claim and making rules so that provider is reimbursed within 30 days. And it's important that, like in Oregon, that's one of our legislative pieces of the puzzle. And these are things that are already in existence with medical. So medical is under a lot of the same pressure and stress of healthcare as healthcare providers that dentists are. And I think we want to, in some degree, catch up with them in the sense that oftentimes legislation will get passed for medical and dental is left out. So I can say for in Oregon, some of the issues that we're addressing are already approved for medical. And that's one of our arguments is it's like, hey, prompt repayment, 30 days, that's acceptable in medical. It's already written into law. We just want to add dental to it.
That's fascinating. That's fascinating to me, because more and more, and I'm sure you're aware of this, more and more the awareness of the need for dental care as it relates to overall systemic health is in public awareness on that is going way up, and we're big advocates for that in terms of what should the mission of a practice be. I mean, we have a speaker coming up, Nathan Bryan, who was at Baylor University for many years, very, very well-known research scientist who, basically in a group, talking to a group at Baylor University, was saying to a group of dentists, was saying, you are the individuals who can be the most responsible for the public health, because so many of these diseases that people have are sourced and come from their oral health. And there's all kinds of science, as you know, on that.
Yeah, and this looping, how I can tie that back to the importance of associations, everything. So when we talked about, I fully agree with everything that you're saying. So we look at something very simple that can be done, and I think it's becoming more common: saliva testing for a number of different reasons that you can use saliva testing for, other chronic problems and whatnot. American Dental Association just approved a code for saliva testing. So that's kind of a big deal, because once you have the code, now we can start going to the insurance companies and seeking reimbursement for that code. But I draw that as kind of how all these things are connected.
Right.
The importance of oral health care, what it is for our general health. More and more we're seeing those correlations, not just causations, but we're also seeing correlation, which is important, between oral health and other chronic diseases. Coming into the dentalist's office, you look at that Venn diagram about how many people don't visit their physician, but they come into the dentist every 6 months. And then something as simple as saliva tests. This is a great preventive thing. It's where dentists, oral health care providers can really provide and help people's general overall health and be, fit more into the medical community instead of just being a silo to make clean teeth and pretty teeth. Now all of a sudden we're going to be doing like some simple saliva testing. This is just one example. Simple saliva testing to do some diagnosing for some of these more greater chronic skills. And if dentists are doing that, then we need the insurance support to get reimbursed for that. Yes. And I really think in the long run that it's lower cost when a dentist is able to provide some of these services than having someone refer them to now all of a sudden see a physician, do a saliva test. I think it can be lower cost all the way around for the insurance company, for the patient, for the providers. I think there's a common ground for everyone involved.
Yeah, absolutely.
Yes, I couldn't agree more. Yeah, go ahead, Sarah, please.
So I am really excited to see that dental assistants are now actually going to be able to do anesthetic. Have you seen any of that coming through on your desk as far as, where they can get training from or any of that? Have you seen that at all, Dr. Taylor?
Yeah, the past couple board of dentistry meetings, we've seen, I think at least 2, I think 3 programs that have been approved for the training for dental assistants to provide that local anesthetic. It's very, very interesting. I believe that we are one of the only states, if not the only state, that's going to allow dental assistants to do that. From our viewpoint is that we will support this, but we really want to make sure that the dental assistants will have that proper training. And I think that we've always want to be advocates for dental assistants, for dental hygienists, the number of skills that they can have in their scope of practice, and particularly for dental assistants, trying to make that position as professional as possible. And let's see if that increases the retention of dental assistants or put them on a pathway to becoming dental hygienists or becoming dentists.
Yeah, absolutely. Well, I just can't even think how many times I was really wishing that my assistant could just run back there and give that AI block, right? Get that done. But now it's coming.
Yeah. Well, just in terms of overall efficiency and allowing for a doctor treatment time, it's a wonderful addition. That's interesting. So Oregon is really ahead of the curve on this. That's very interesting. Is the saliva testing? Did I hear you correctly when you said the saliva testing that is national, or does that now have to be adopted by the individual states? How does that work?
So the ADA is the one who sets all the dental codes when we bill out for an MOD alloy, MOD composite, surgical strategy. And I just within this past week, if not yesterday, I just saw an email saying that of the new codes. So the American Dental Association has a code committee that they oversee, and that is who approves these codes. So another example is after the pandemic in 2020, Oregon was a leader with others as well, as far as getting a code approved for giving vaccinations.
Oh, really?
And so
Interesting.
similarly, I just saw very recently, like I said, I think it was within the past few days of there's now going to be a code. So that may not come out till 2026. I don't know when it officially becomes official, but it was approved, a code for saliva testing.
Excellent. Excellent. That's very good. That's good. That's very good news for our listeners, and something that they should definitely need to make note of.
I think,
You know,
I don't mean to interrupt. To
no,
me,
go ahead.
when people say like, "Oh, I don't want to be a member," and like, "What are they doing for me?" It's sometimes things are very high level, 30,000 feet,
Yes.
and this brings me back to that your original question about like, what does the ADA Council on Communications do? And it's my job. It's also at a state level our job of trying to get that message out to dentists, saying like you're doing saliva testing, you're not getting reimbursed for this. What can you do about that on your own? Well, there's not much you can do about that on your own. Well, now the ADA is going through this long process of getting a code approved for it, and then we will be now advocates for getting third-party payers to reimburse for that, and then that trickles down to the provider. Maybe it's in 2027 where all of a sudden they are now getting some type of a benefit where they can be reimbursed for that. And if they're reimbursed for it, let's be honest, they're going to be more likely to be doing saliva testing. But I think it's a good example of what we do for dentists, and why membership's important.
Yeah. Well, I'll just make this comment, Sarah, and then I'll shut up and let you ask your question. Sorry, but I'm just so interested in what Dr. Taylor is saying here as far as the community and the group. Anybody who studies organization and corporate structures, but just historically, from a sociological point of view, groups historically accomplish far more than individuals. It's just a fact. They do. But unfortunately, there are those who are, they're the loners. They have to be kind of on their own. That they object to that. But the fact of the matter is, and your point is very well taken, and is a perfect example of it, that what is a doctor going to do? Go to Salem and advocate for reimbursement on saliva testing? Certainly, that's an incredibly valuable function for you to be doing, that they're not going to do on their own. So, yeah, we're with you 100% on that.
Oh, for sure. So just wanted to piggyback again off of, the association and staying involved. What are the best practices for staying engaged with your state dental association, and how can members plug in and get activated?
In Oregon, we have 14 components, and we always, I think, and I'll be honest, unfortunately, in this day and age, for a number of reasons, that component structure is not as strong as it used to be. I say that's unfortunate because when I read about the increased burnout and loneliness and stress that dentists are feeling, and in my mind, kind of like, we have this great model to where on a semi-regular basis, you could be meeting with your colleagues, and I think getting a lot of peer-to-peer support, which is great.
It's incredibly therapeutic.
But even outside of that, sometimes when I talk to people about membership, we don't need and we don't expect every single dentist who's a member to be as involved as I was, or as some of our other leaders. A lot of what we need is just the support of members. I'll be honest, because when we talk about all these lobbying efforts that we're doing down in Salem, Oregon, that takes a full-time staff member. It takes my time. We have 2 lobbyists. We have a communication specialist. They have to be paid, just like your staff. If you have a strong office, you have a staff to be paid. We're the same way. And so a lot of times for that engagement, we're just asking like, okay, if you don't be involved, that's fine. But, how about membership, and help us support these advocacy efforts that we're doing? Another thing I think it's very, very important when we talk about advocacy, our entire legislative agenda every year, ever since I've been executive director, and I will speak for the past 5 years, our legislative agenda is generated truly by our members. I'm not going to the board and saying we should be doing this, we should be doing this, we should be doing this. we have this full committee process. An individual such as Dr. Kim Wright, a dentist in Westland, Oregon, she has an idea, she presents it to us. This committee, Regulatory Affairs Committee, says like, hey, that's a good idea. That is then moves up, and the board at some point approves our legislative agenda. So all this advocacy, it really truly comes from our members and is member generated. So when we talk about being engaged, again, like, you don't have to be a leader, but be a member. You have an idea, share that idea with me, and then it's my job, my team's job, to take that idea, and if the board and others think it's a good idea, to run with it. And then you don't have to do anything, but we need those ideas. We need those members to get those ideas.
Yeah. Great point. Yeah, I'm interested just from a nationwide point of view. Again, you have the benefit of years of experience as a provider yourself, and now as the head of an important association. What kind of what can you share on a national basis to others who are doing similar administrative and overseeing tasks and responsibilities that you're doing?
That's a long question. Ask that to me one more time. I want to make sure I go down the right track.
What would you share as some of your best practices with your colleagues around the country that have been successful for you as the director of a state association? There are a lot of people in your position. I think there is an executive director national association, isn't there?
There is.
Yes.
I think the most important thing, in my mind, who I think the best executive directors are those who are truly the servant leaders, and that's an actual school of thought. There's websites, books all about servant leadership. I think that's really, really important to always remember that we're an association and we're driven by our members. I work for a board of trustees. I report to them, and I think keeping that in mind, and I know that dental practices have changed a lot. We have approximately 20 to 30%, depending how you're defining it, of large group practices of some type. So the whole idea where it was 90% solo practitioners, that's down to 80 to 70%. A large group practice, not large group practice, it could be anywhere from 2 doctors working together to what the large chains and whatnot. But in my mind, I think that there's still enough commonalities, and we're seeing it with our legislative agenda in Oregon. There's enough commonality that we can find stuff to all be advocates for, to all agree on, and we still have enough to form a tight community with all that, and we need to kind of drop the labels and thinking that dentists are different because they practice in a certain type of practice. I think what we need to really focus on, and what I try to really focus on, is all the common things that we do have. And what it comes down to, we will all want to increase access to care, and we all want to provide excellent oral health care. We want, I would love to see reports that show that Oregonians have the highest level of oral health care. And those are things that we can all agree on, and we can all fight for and be advocates for.
100%.
Great mission. Yeah. Have you we bring this up a lot with people in the dental industry, Barry. Obviously, particularly over the last 5 years, we have the DSO phenomena happening. It's cooling. The activity, obviously, also is cooling off a bit. There are economic and other reasons for that. How are you seeing that impact dentists or dentistry under your leadership or aegis?
Well, I'll be honest that a lot of these large group practices, if it's a DSO or whatever label you want to give them, our challenge is that some of the things that we used to provide, they're getting. I'll be honest, I worked for a large group practice. I worked for a Willamette Dental Group for a number of years. And the advantage of working there was there were 6 other doctors in the office. So
Yeah.
Now all of a sudden you are getting some of that peer-to-peer support. You are getting some of that friendship and support and whatnot. And so that, I think sometimes that may work against us as far as like when I talk about the component structure and whatnot. And then today, though, when we look at advocacy, though, that's where I go back to the common ground, because we're in Salem looking for higher dental rates, both for Medicaid patients, but that's also going to filter into fee for service as well. So again, that's where it comes back to, okay, so some of your needs at the large group dental practice may be met. I know the larger dental group practices provide a lot of continuing education. Those are all things that exclusively you had the Oregon Dental Association provided that, or the Oregon Academy of Dentistry provided that. So a lot of those needs are now being met by those larger group practices. So that's why I always just try to go back to things like wellness and other things that we have in common. We still need to be all together. And I could go on for another half hour, and you hit on a really important thing, Alan, about, and I don't think everyone realizes the role that associations played in the founding and the growth of the United States. It's really, really fascinating. But that's a different tangent that we don't have to go down today. But the point being is that
I don't think it's unrelated. I don't think it's unrelated at all. I think it's a very important part of this conversation. So please feel free. I'm very interested in what you're saying.
Oh, I just think that they're very important in supporting in like so many professions in the growth, in that growth of creating these associations of different trade groups, however you want to look at it, and what that did for increasing income, what that did for increasing community, what that did for increasing the level of care with a lot of things. It's a fascinating history in the United States, many other developed countries as well, but particularly if we're just going to focus on the United States, trade associations played a huge role.
No doubt. No doubt about it. No doubt about it. Every great movement historically. Yes, there have been leaders, there have been people who initiated, but who never would have been able to do it unless they had the ability. I mean, really good leaders, they have the ability to develop and nurture and expand group effort. That's what it's all about. And that's how these major hurdles are overcome. Yeah, I can't imagine why a dentist, honestly, just from the advocacy. I mean, your example of saliva testing, it's small, but it's not. I think it's perfect. Just a practicing dentist. There's no reason why he or she would not want to be able to participate in that and know that there's somebody to turn to who's going to advocate for their profession. Which, even if it's an entirely selfish point of view, that's perfectly okay. It's perfectly okay.
I fully agree with you.
Yeah, well, hey guys, I want to switch gears because one of my favorite topics is the Oregon Dental Conference is coming up. So this has been a huge event that I look forward to personally every year. I think I've attended the last 18 years in a row, except I missed last year. So I guess not in a row anymore. But yeah, I'm super excited about this. It looks like it's April 3rd through the 5th. Yes. And Dr. Taylor, do you want to kind of elaborate on what our theme is for this year?
Yeah, it's, I think we're still a couple of years ago, right after the pandemic, it's connect, growth, and learn. But it's that connect word. And I still think one of the greatest values to the Oregon Dental Conference, and we've done surveys in the past, shows it's the networking opportunity. We have, e-practice management and so many other exhibitors were there, over 100 exhibitors. We're excited this year because we have the 3 big supply houses coming back to be exhibitors. So we have the great continuing education. I think another advantage of the continuing education is that most of the courses, well, all courses, a dental assistant, office manager, a dentist can go to any of the courses, and some are focused in different areas. But it's a great opportunity because you have a lot of courses that will, and I'm someone who goes around and does lectures. It's always great, I think, when you have these in-person courses that have dental assistants, hygienists, dentists, office managers, all there in the same room. And there's, you know how that is. You have the hallway conversations, you have the conversations in the exhibit hall, you have the visiting with the exhibitors. That's all stuff that we can't do virtually. I can get my 40 hours of continuing education, you know, in the next 3 days by going online, but you just miss out so much versus going to an in-person meeting. And I think a lot of those hallway conversations, visiting all the nonprofits, people that we have there, going into the exhibit hall, visiting e-practice, visiting the supply houses, visiting all these, the dental labs. You know, I think there's just so much value in that. And you, for me, visiting the exhibitors, a lot of it is like, okay, I think I have everything in my practice. I think I'm all dialed in. Oh, like I wasn't aware that this service is available. I wasn't aware that this service. Oh, well, something I
Yeah.
didn't think I needed. Well, maybe let me talk to you. And
Yes.
you can't get that type of interaction on anything virtually. You can't get it from emails, promotional emails that are sent out from any entity. I think those conversations, that sense of community, that, and when we talk about networking, it's just not about me talking to other dentists. It's about me talking, Sarah, like you and I, we always chat. I mean, so many things that have come together with the Dental Foundation of Oregon. You're now on the Dental Foundation of Oregon board. You know, that type of networking, building community, it's huge. It's great, and it still is the largest conference in the Oregon for dentists. You know, we still have close to over 400 dentists attending. We'll
Nice.
have close to 3,000 attendees. So it
Nice.
still is an absolutely great big meeting with so many advantages of being in person that cannot be replicated via virtual modes.
Now, I have a couple of people that we always see each other at the ODC every year, and that's like the only time we talk, we text, we see each other on social media, but to actually give that person a hug, that's unmatched. And then yes, you touched on something that I'm going to do a shameless plug on. Dr. Taylor and I are both on the board of directors for the Dental Foundation of Oregon, which oversees the tooth taxi, which goes out to rural parts of Oregon to provide care for children. And if you are going to be attending the ODC, highly, highly recommend come checking out our wall of wine, and also taking a look at our new bus. We have a brand new tooth taxi, which is state of the art, everything. Blows the old one out of the park. So definitely everybody needs to come and take a look at that. So sorry, Alan, I'm going to do a quick plug for that as well.
Sarah, I love it. You got to send me a picture of the tooth taxi. This I have not seen.
It's amazing. In fact, I'll send you a keychain too soon.
Oh yes, I want one. This is great. All right, hey, Dr. Taylor, what a pleasure! What a pleasure to have you here. And any closing message for your peers and your colleagues and those who are going to watch this? This gets redistributed throughout the country to all of the dentists that we know. It's on LinkedIn. So any closing thoughts?
I think this conversation, it was fun. For me, it just really speaks to the greatness or how important the dental community is.
Yes.
And we had this conversation and the relationship that Sarah and I have. She was talking about the Dental Foundation of Oregon, but I've also talked to her quite a bit about e-practice. Like these type of relationships, this type of connectivity and networking.
Yes.
For me, that's what makes an association, because we came together because of an association. You reached out to me, and that's how Sarah and I first met. And so I can't stress enough the value of the engagement and this being a part of the community, being a part of something bigger. And selfishly in the long run, it is going to help. We're out there advocating for dentists, and you can't do advocacy by yourself. I've been down to Salem already 4 times this year. Our lobby team is down there every day. I've spoken at 3 hearings, and I will tell you this: at every hearing I have testified at, there has not been an individual Dr. Joe Schmo who has just come in there independently and testified. I mean, the fact is that if it's not us, it's going to be other parties, other groups that are doing it, and that's why it's really, really important to support your association, and support the partners that we have as well.
Yes. Yeah. One wonderful message. We're with you 110%. We are delighted to be able to be at your conference this year and support it and talk to your members and all of their people. Yeah, I couldn't agree more. You know, it's a symbiosis. It's a symbiosis, Barry, and I think that message needs to be promoted. So thank you so much for being with us. This was very, very good. We will see you up in the Great Northwest in a week or so. Unfortunately, I won't be there. I do get to Oregon a lot. One of my favorite places in the United States. Lived there for years, and I miss those summers like nobody's business. But Sarah will be there, and Gillian will be there from our company, and look forward to having a great event. And again, Barry Taylor of Oregon Dental Association, thank you so much.
Thank you for the opportunity. That was fun. I greatly enjoyed it, and thank you very much for supporting the Oregon Dental Conference. We appreciate that.
Absolutely.
All right. Well, then we will see you soon. Thanks so much, Dr.